Ever had a moment where you know you're getting air, but it still feels like you can't breathe? That scary feeling can happen in asthma. Because asthma doesn't just affect the lungs, it affects the airways, the breathing tubes that carry air in and out. Stay with this video for 5 minutes because you'll learn the warning signs, the most common triggers, what an asthma attack looks like, and how people control asthma long term. Why asthma matters. Asthma affects people of all ages and can come and go, sometimes mild, sometimes severe. Even when symptoms are not constant, asthma can flare up when triggered, which is why understanding your triggers and treatment is essential. What asthma is? What happens inside your airways. Asthma is a chronic lung disease caused by inflammation and muscle tightening around the airways, which makes breathing harder. In asthma, the airways can narrow and swell, and they may produce extra mucus, so airflow gets limited, especially when breathing out. Think of it like breathing through a straw that suddenly got tighter and stickier. This is why people may wheeze, cough, or feel chest tightness. Common symptoms. Classic asthma symptoms include coughing, wheezing, a whistling sound, shortness of breath, and chest tightness. For some people, asthma is mild, but for others it can interrupt daily life and may lead to a life-threatening asthma attack. Symptoms can vary over time, meaning someone can feel okay for weeks, then suddenly flare with the right trigger, wheezing especially when breathing out, coughing often worse at night or with triggers, chest tightness or pressure, shortness of breath. Triggers are things that irritate or inflame the airways and can start symptoms or an asthma attack. Common triggers include airborne allergens like pollen, dust mites, mold spores, pet dander, and cockroach waste particles. Other triggers include respiratory infections like colds, exercise, cold air, smoke and air pollution, strong smells, stress, and even some medicines like beta blockers or aspirin and NSAIDs in certain people. If you know your triggers, you can often prevent the attack before it starts. Asthma attack exacerbation. What an attack is and why it can be dangerous. An asthma attack is a flare-up where the airway lining becomes more swollen and the muscles around the airway tighten, narrowing the airway and reducing airflow. During an attack, breathing can become very difficult, and attacks can be fatal if not treated. This is why anyone with symptoms should talk to a health professional and have a plan, not just hope it goes away. Diagnosis and treatment. How asthma is managed. Long-term asthma can't be cured, but symptoms can be controlled, and treatment often needs adjustment over time. Good asthma management usually includes avoiding triggers where possible, using medicines as prescribed, and tracking symptoms so treatment can be stepped up or down appropriately. Because triggers like smoke, pollution, and allergens are common, controlling the environment at home and work can be a major part of staying stable. Prevention habits. Practical, everyday steps. Reduce exposure to smoke and irritants. Because smoke and air pollutants are common asthma triggers, take colds and respiratory infections seriously, since infections can trigger asthma symptoms. If exercise triggers symptoms, a clinician can help adjust the plan so you can still stay active safely. Asthma may be part of your story, but it doesn't have to control your life. Control comes from knowledge, preparation, and consistency. If you found this helpful, like this video, share it with someone who needs it, follow for more simple health explanations, and subscribe because your health education is your real-life superpower.